Welcome to PSY 318, Study Session 3, Emotional and Social Disorders. Introduction. This lecture introduces you to the emotional and social disorders. This includes specifically reactive attachment disorder, separation anxiety disorder, phobias, and childhood depression. The symptoms, causes, and treatments for these disorders are also mentioned for better understanding of the part of the students. Objectives. At the end of this lecture, you should be able to 1. Identify the emotional and social disorders in children. 2. Discuss separation anxiety, reactive attachment disorder, and phobias in children. And 3. Mention the factors that trigger childhood depression. Pretest. 1. What are emotional and social disorders in children? 2. What are the factors that trigger childhood depression? 3. What do you understand by depression? 4. Mention the types of school phobias that we have. Content. Reactive attachment disorder. Reactive attachment disorder is characterized by a marked disturbance in child's ability to relate to other people. The disturbance begins before the age of 5 years. Children with this disorder fail to show social attachments that are appropriate for their age. There are 2 subtypes: the inhibited and the disinherited subtype. The inhibited subtype entails a persistent failure to initiate or respond to interpersonal situations. The child tends to be highly inhibited, constantly observing the behavior of others, and resist physical contact or comforting. The disinherited subtype shows an opposite pattern of behavior. These children are indiscriminate in their social response. They respond to strangers and familiar people in the same way, with lots of physical contact and express need for comforting. The diagnostic criteria for reactive attachment disorder include the child's early experiences, as well as symptoms. In order to receive this diagnosis, the child must have been exposed to serious neglect or outright abuse during some period before the symptoms began. It is assumed that inadequate care causes the syndrome. Because reactive attachment disorder is a new diagnostics category in DSM-4, there has been relatively little research on this prevalence, specific causes, or treatments. Some practitioners advocated certain forms of therapy that they believe are effective in treatment of reactive attachment disorder, while other clinicians have expressed their doubts about the appropriateness of this therapy treatment. Separation anxiety. Fear and anxiety that children experience when separated from their parents or primary caregivers. Psychologists consider separation anxiety a normal part of a child's development. It usually begins when the child is 8 or 9 months old, peaks at about 14 months, and then gradually subsides. The onset of separation anxiety coincides with the child's development of object romance. The ability to understand that people and objects still exist when they disappear from view. Infants with separation anxiety cry or become irritable and distressed when separated from their parents. When separation anxiety continues well into childhood or reappears later in childhood or adolescence, the diagnosis may be separation anxiety disorder. Children with this disorder worry excessively about the safety of their parents. They may fear that their parents will die or become ill. They may worry that some danger, such as kidnapping or car accident, will lead to separation from their parents. They are often scared of being alone and may refuse to go to school because of fear of separation. Children with this disorder often act in demanding or intrusive ways and seek constant attention. At bedtime, they may insist that someone stay with them until they fall asleep. Some children experience physical symptoms such as headache and nausea when they anticipate separation from their parents. Sometimes, separation anxiety disorder continues into adulthood. Adults with separation anxiety may refuse to move from their parents' home or feel unable to live independently. In addition, they may experience anxiety when separated from their spouse or children. Researchers are unsure what causes separation anxiety disorder. Often, the symptoms begin after the children experience some loss, such as death of a family member or a pet. Treatment involves gradually exposing the child to separation experiences, such as attending school and teaching the child how to overcome his or her anxiety and irrational thinking. In addition, the therapists often work with the parents to ensure that they do not inadvertently aggravate their child's separation anxiety through overprotective parents. Phobias. At some point, many children experience unjustified fear, so extreme that he or she is immobilized. Childhood fears are a universal phenomenon. Although there are cultural differences in their content and intensity, the nature of fear also varies with age. Fears become phobias when they are out of proportion to the reality of danger that an object presents. The following cases demonstrate the transition of fear to phobia. School phobia is one of the most common and problematic childhood phobias. It creates great distress in both children and their parents. Many children with school phobia do well in school and express desire to attend, but they experience intense anxiety when they get ready to go to school. For example, they may go to the toilet frequently, feel sick, or sweat profusely when the topic of school is brought up. Unlike the trans whose parents are often unaware that their child is not at school, these children stay at home during their prolonged absences, and their parents know exactly where they are. Some specific and effective behavioral treatments for phobias include desensitization, which involve gradual exposure to the feared object, and therapy that involves some work with the parent. It is important that parents be involved in the process so that they can monitor their child's behavior. The therapist also helps the parent to identify any behavior on their part that might be subtly encouraging and maintaining the child's phobia. Many cases of school phobias have causes other than separation fears such as social or academic fears, depression, and fears of specific objects or persons at school. Case study. Sarah was referred for treatment of her phobias when she was 13. She acknowledged that beyond airplanes and bees, she was also afraid of elevators but nothing more. Yet, after she came to know and trust a therapist, it emerged that there was a fear that underlay and linked all others. That was a fear of anesthesia. A number of years earlier, Sarah had to have a tooth extracted. The doctor used the general anesthetic. As she went under, everything went black, but Sarah could still hear voices and rushing voices. She was not prepared for this sedating. They terrified her. Ever since, she was diligently avoided, putting herself in a situation where she might be injured and therefore be rushed to the hospital. Airplanes crash, so do elevators. Bees sting. Any of these might land her in the hospital. The therapist later treated Sarah in relaxation technique that could be used in situations of high anxiety. Within 3 months, Sarah had reported no more difficulties. Childhood depression. Childhood depression is an emotional disorder that has the highest lifetime prevalence. Prior to the 1970s, many clinicians assumed that pre-adolescents were unlikely to develop depression. In recent years, Researchers have found that pre-adolescent children can and do develop symptoms that make up the syndrome of depression. Children, like adults, may develop depression. Between 2 and 4% of children under 17 years of age experience major depressive disorders. The symptoms in young sufferers are likely to include physical discomfort, irritability, and social withdrawal. APA 2000. Explanations of childhood depression are similar to those of adult depression. Factors such as loss, learning helplessness, negative cognitions, and low serotonin or epinephrine. Take 2. Factors such as loss, learning helplessness, negative cognitions, and low serotonin or epinephrine activity are indicators. Also, like adults, many cases of childhood depression seem to be triggered by a negative life event, major change, rejection, or ongoing abuse. Like depressed adults, children with depression are at high risk for suicide. Like depression among adults, childhood depression often is helped by cognitive therapy or interpersonal approaches, such as social skills training. In addition, family therapy can be effective. Antidepressant medications also seem to help some depressed adolescents. Depression is a mental illness in which a person experiences deep, unshakable sadness and diminished interest in nearly all activities. Severe depression, also called major depression, can dramatically impair a person's ability to function in social situations and at work. People with major depression often have feelings of despair, hopelessness, and worthlessness, as well as thoughts of committing suicide. Depression can take other forms. In the case of bipolar disorder, sometimes called maniac depressive illness, a person's mood swings back and forth between depression and mania. In younger children, depression may include physical complaints such as stomach aches, headaches, as well as irritability, moping around, social withdrawal, and changes in eating habits. They may feel unexcited about school and other activities. Summary: reactive attachment disorder is characterized by a marked disturbance in the child's ability to relate to other people. There are 2 subtypes of reactive attachment disorder: the inherited and the disinherited subtype. Separation anxiety is the fear and anxiety that children experience when separated from their parents or primary caregivers. When separation anxiety continues well into childhood or appears later in childhood, or reappears later in childhood or adolescence, the diagnosis may be separation anxiety disorder. Some children experience physical symptoms such as headache and nausea when they anticipate separation from their parents. Adults with separation anxiety may refuse to move from their parents' home or feel unable to live independently. Fears become phobias when they are out of proportion to the reality of danger that an object presents. Many children with school phobia do well in school and express desire to attend, but they experience intense anxiety when they get ready to go to school. Some specific and effective behavioral treatments for phobias include desensitization. Researchers have found that in recent years, pre-adolescent children can and do develop the symptoms that make up the syndrome of depression. Between 2 and 4% of children under 17 years of age experience major depressive disorders. The symptoms in young sufferers are likely to include physical discomfort, irritability, and social withdrawal. Post-test. 1. Reactive attachment disorder is characterized by dash in the child's dash. 2. There are 2 subtypes of reactive attachment disorder, namely A dash, B dash. 3. The reactive attachment disorder begins before the age of dash years. 4. The diagnosis criteria for reactive attachment disorder include dash and dash. 5. Some forms of dash are effective in the treatment of reactive attachment disorder. 6. Separation anxiety disorder begins when a child is dash months old. 7. Infants with separation anxiety dash or become dash and dash when separated from their parents. 8. Children with separation anxiety disorder dash about the safety of their parents. 9. Treatment of separation anxiety disorder involves dash. 10. Causes of school phobias may be caused by academic and dash. Mention one fear. 11. Children like adults may develop depression. End of study session 3. Thank you for listening.